in December, 31st December 2024. At the end of the expiration, out of the 950 facilities, only 450 facilities had been connected. At this point, you'd all agree with me that the contract was meant for 3 years and extended for 5 years for 950 facilities, and you have only delivered 450 facilities. Clearly, nobody needs to tell you that the company underperformed. And so when we took over, as part of the contract, they were supposed to hand over whatever they executed to the state. So the contract was divided into what we call milestones. Milestone 1, milestone 2, milestone 3. So at the end of each milestone, they are supposed to hand over to the state. You all agree with me that it's unconscionable for any individual or company to have access to the medical records, electronic medical records of Ghanaians without the state taking control, without the state having access to it, without having even access to the service. With a cloud infrastructure built somewhere in India. At this point, when we took over, we invited the vendor that the contract had expired and therefore they must hand over to the state. And so we needed to understand exactly what we were taking over. So a forensic audit was conducted. And what we realized was that even the hardware, there were gaps in the supply of the hardware. The supply of computers. If, assuming in the contract is stated that they should supply HP laptops, you go and cheaper brands are supplied. They should supply, let's say, 100. You go and less than 100 is supplied. So there were issues of quality of the equipment or material supplied, and there were issues of quantity, the number supplied. And so upon analysis, you realize that the gap alone for the hardware was not less than $18 million. Again, I have stated that the contract sum was $100 million. At the end of 31st December 2024, although 450 out of the 950 had been connected, the vendor had been paid about $77 million. Clearly, more than 70% of the total amount had been paid. And less than 50% of the work has been done. At that point, we had to refer everything to the AG and the appropriate quarters in radio security for advice and appropriate action. As a ministry, what we had to concern ourselves with was the solution of the matter to get out this mess. In order to avoid these disruptions and the shutdowns we are experiencing, although we didn't have any contract with the vendor as at the time we took over, we indicated to the vendor that the ministry was ready to sign service maintenance agreements covering the 450 health facilities. Don't forget that the software is and was not for the state. That is why it's called Lhims, Lightwave Health Information Management System. It's not for the state. In the agreement, we indicated that before we sign such an agreement with you, you have to hand over the data to the state, and you must give us administrative access to the service. The vendor insisted that those clauses must be expunged from the agreement. We cannot expunge those clauses from the agreement because it is the state that must take charge of these data. So the vendor decided to switch the system of as and when he desires and as and when he demands what. And this has gone on for some time now, more than 2 months. And for the past 2 weeks or so, the system has been completely down. If this is not blackmailing, I don't know what it is. At that point, what was important was to find a solution to get out of this mess. And so, ladies and gentlemen, the good news is that we have the solution. And the solution, in finding the solutions, we have taken cognizance of the issues that have gotten us here. And so it was the issues we were resolving one after the other. What were the issues? The issues, one, was that the software didn't belong to the state. And so when we are going for any new software, the software must be for the state. And so today we have Ghims. And the Ghims is Ghana Health Information Management System, and not for any individual. The next solution was the fact that there was nothing like any exchange. And so we have established an exchange where even if you invite any vendor in, the vendor will then plug in and will not have, any vendor will not have a direct integration to our billing system or to any other sector. You necessarily will have to go through the exchange. Again, we realized that we're going through these difficulties because the system was monopolized. It was only one person we were dealing with. What is the solution? The solution again is that out of the 950 health facilities, only 450 have been connected, and therefore we have an outstanding of about 500 health facilities. Going forward, we'll open up for companies and players in the sector to bid, provided they meet the necessary requirement. So that we'll open it up and they will all go through the exchange, the middleware, so that in future we will not end at where we are at the moment. The plan going forward is that in the next 1 week, we are going to begin with the teaching hospitals, the regional hospitals, and the highly populated district hospitals, to roll them over onto the system, the Ghims. In the second week, we'll be looking at the rest of the district hospitals, and then in the third week, we'll be looking at the polyclinics, the health centers, and the CHIPs. In the fourth week, we'll do the mop-ups. So I am confidently announcing to the good people of this country that we have a 4 weeks plan that will get us out of this mess. And so at this point, I will allow Dr. Anita Opon to do her presentation, and that will be followed by Conrad Jokoto, to also present to you the Ghims system, how it's going to function, and tell you some of the superior functions of the Ghims system. So I thank you very much for the opportunity.
Lhims had completed 481 facilities. But based on the verification, we realized that it was actually 450 that was operational. 31 had not been made operational. It was not on the ground. And this was concentrated in the eastern region, and most of them were in the health centers. So out of the 450 verified, we realized that 443 were completed during year 1 and year 2. So they had 6 milestones, and they completed whatever was assigned to them during year 1 and year 2. So when the contract was renewed, the 2-year renewal they had, they were expected to deliver 157 more facilities. And out of the 157, which the government of Ghana paid for, they only delivered on 7. So these are the payment versus delivery. So you see that year 1 and year 2, all the 6 milestones, they were supposed to deliver 443 at a total cost of $66.3 million, which they did, and it was accepted. So when it was renewed again, that was year 3, they were expected to deliver 157, deploy 157 facilities. They only delivered 7. They deployed 7, and it was accepted. Bear in mind, they were paid for the 157 for year 1 and the milestone, year 3 and milestone 1. But only 7 sites were accepted by end of year 31st December 2024. The issue with year 3 and milestone 1, why this matters. So you see that we are exposed to them at an approximate sum of 10.1 million of prepaid but undelivered scope of work. So the risk here is with the contract expiring, government enforceability weakens unless there is a very valid extension or variation. So when you look at the table here, you see the tranche. We paid 10.6 to them to deliver 157 facilities or deploy 157 facilities, but they only deployed 7, representing 4.4% of the work they needed to do. So you see, approximate value of delivered sites is 472,000 plus, and we had already paid 10 million to them. So if we do the hardware analysis, if we take the desktops, they charged $600 per desktop, per their own specifications. And for the total contract period, they were expected to deliver 25,799. For year 1 and year 2, they were supposed to deliver 13,125 laptops. So you see that according to their own documentation, as per way bills with the Ministry of Health, we realized that what they had was 5,054. But the team decided to go ahead and do physical verification and even counted laptops that had gone bad, the ones that were not good, and what we got was 7,060. The variation here is 6,065 that were not supplied, but monies were taken for. Then if we take the mast and grounding, they were expected to do 9,052 within the total contract period. For year 1, year 2, we're expecting them to do 445, that's 145. According to the ministry's documentation, they only did 49. But when we did the physical verification, we realized they did 73, which were very poorly executed. And so if things are not done well, you can imagine the consequences this will have on our equipment. So you see the variation there is 372 undelivered work. And so they didn't do 83.6% of the work. Meanwhile, they had taken the full amount. So total exposure from our audit findings for year 1 and year 2 scope, based on the hardware, you see our exposure is 18.9 million, which has already been paid but not evidenced in the field. These things were not deployed properly. Then you see for year 3 milestone 1, supplier was paid 10.6 for a new milestone. He only delivered 4.6% of what he was supposed to do. And so there is also an exposure of 10.1. In total, there is 29 million exposure to be reconciled with the vendor. So these are some of the audit recommendations. Audit recommendation 1, the audit identified significant gaps in delivering the hardware software integrations across reported sites. So the recommendation is that these gaps to the relevant state authorities have been forwarded to the relevant state authorities for verification and advice. So they will do what they need to do. And I think the minister mentioned this when he was addressing us. Second recommendation was immediate custody of systems and data, which the minister also addressed extensively. And so following the second recommendations, these were some of the actions we took, which the minister also talked about. Recommendation 3 is interim license to protect service continuity, which he again addressed extensively. So out of the minister's or the ministry's good faith efforts, these are some of the actions they have taken, which he actually spoke about here. And you realize that based on the vendor's attitude, he has breached our Data Protection Act. So we expect the relevant authorities to also do what they need to do. And my recommendation 4 is to establish a national health information exchange as a single integration layer, which the minister talked about, and my colleague Conrad will take us through the exchange. So this is also about the exchange. So recommendation 5 is what he talked about, going to open up tender so that Ghanaians who are qualified and who are able to do the work will be able to take it up and do it well. So to conclude, we want to reiterate the fact that the contract actually expired on 31st December 2024. At the time of the expiration of the contract, the vendor had underperformed on the contract, delivering on only 450 health facilities out of the 950, despite being granted an extra 2-year extension to complete the project, totaling 5 years in total. He couldn't deliver. The ministry extended a good faith SLA for the maintenance of the 450 sites, which the minister actually talked about, while the issues from the audit were being handled. The vendor refused this offer. The Ministry of Health, as per recommendations and policy, has established the National Health Information Exchange, which now ensures that no single vendor or private entity has control over the sovereignty of our health data and systems. So thank you very much. Conrad will take us through that.
So at this point, Conrad will take us through the solution, what we are going to roll out. So come.
Mr. Minister, thank you so much for that.
Conrad, introduce yourself.
Okay. So my name is Conrad Jogoto. I'm a member of the Ghims team, the solution to the problem that we are currently facing. So the Ghims is an end-to-end application that takes care of all the processes that happens in the hospital. Every user in the hospital will be given a username and a password. And with that username, it defines the scope of what you are able to do in the system so that our health information is not exposed to just anybody. So once the application is open, like you see on the screen, with a username and a password, you are able to log on, and as you log on, you see that what you are able to do in the system. So where we are now is a typical customer relation on a front desk personnel's interface, who are the first point of interaction whenever a patient visits the hospital. Now, we talked about integration with the National Health Insurance Exchange. And one of the good things about Ghims is that if you're a patient and you reported at Tamale and say you come to Accra, with the integration with the National Health Information Exchange, we are actually able to pull your data from the exchange so that it's available in Ghims. So here, what we are doing is that we've entered a National Health Insurance number, and then from the exchange, we are able to get the data that the exchange has about the patient. And from there, we are able to go directly register the patient into the system, and then care continues from there. So that there is no issue of you in Tamale, so we don't have your data. Ghims and the exchange will make the data available to you. Now, from there, we move on to how nurses interact with the system. The nurse will have this home page, and once they click on the patient folder, they get to see this beautiful interface. That is a particular patient folder. And everything that is happening to the patient, they are able to record it, from vital signs to triaging. And we have different models depending on what type of specialty you are. So if you're an inpatient, you have your inpatient tools that you need. We have different sort of charts in there. So for those who are with obs and gynae, who might be using the pathograph, we have a pathograph chart there, beautifully filled, that will allow you to capture what you are doing. So, and then we also have the 4-hour chart. The ICU nurse would also have the tools that they need to work with. And everything that is happening to the patient is captured at one central point that can be reviewed as you see. So we can move on to a typical doctor's interface. When we open the doctor's interface, a similar folder, the same folder, but with a different set of tools. Because what the doctor does is a little different from what a typical nurse would do. So one of the doctor's primary tools is the presenting complaint form. So here for my test patient, we pre-filled it, but we can take a new one and just see how the interface looks like. So when we scroll up, we have the add new button here, and then the doctor is able to fill this point. We've made it easy for the doctors by segmenting it according to how their work flows when they are dealing with a patient or they are giving care to a patient. One good thing about this interface is that it is immediately the doctor enters something like the prescription for medications, the laboratory request, radiology request, nursing request. Immediately the doctor saves that particular interface. Immediately the nurses will get their portion of the data, pharmacy gets their portion of the data, and laboratory also gets their portion of the data, so that care continues smoothly without any hitches. So this is a typical laboratory technician's interface. The homepage gives them access to know which of the labs that the doctor requested is done, those that are pending, those sort of alerts, so that their work can continue quickly. So let's go into the typical laboratory technician's interface. So they have this interface, and you realize that the data depends on what the facility wants the technicians or a particular unit to see. Again, data protection and making sure that patient confidentiality is maintained. So for this particular interface, they get to see the vital signs, and then if you hold on to this interface, as you see, the investigation request is the request that the doctor puts in, and then they can either print out that request or go ahead and make the investigation if that is so needed. So we will move on to the pharmacist, similar interface but slightly different based on the needs that the hospital has for them. So this is just a brief overview of the Ghims and how it interacts with the National Health Insurance Exchange and how we can get data consolidated at one place. Thank you so much.
Have any questions relating to the presentation made or the minister's remarks? We would invite you to do so. as is the usual rubric, walk up to the microphone, introduce yourself, your media organization, and then fire away.
Media.
All right. In the interest of time, I advise all of you to move towards the microphone. So, please adjust the microphone to you. Yes, okay.
Thank you. My name is Abdul Hanan Adam, AIB Network. Minister, I want to find out from you, since the vendor did not execute the contract well, underperformed but was paid about 70% of the amount. Is it, are we to expect that the ministry or government will go after the vendor to ensure that the person supplies the right quantity and quality of materials, or will retrieve our monies back? And secondly, I also want to find out whether it was not really clear whether this new system will have the data from the earlier system being migrated onto the new system, or it is going to be a new registration altogether for patients. I just want that clarity. Thank you.
Right, thank you very much. Yes, I thought I saw Kwabena move towards the microphone. Okay.
Maxwell Mbadwa from Joy News. It appears it is fait accompli for Lightwave. I just want to find out from the minister. Now we are trying to open up the bid for more companies, competent companies, to come in to bid if they have the capacity. Are you going to consider Lightwave should they come? And then my second question also, if they agree to make adjustments to the service level agreement, would you be willing to reverse, this position that we've taken, or it's fait accompli? Last question. Honourable Minister, you were, sorry.
Right.
Last one. You were the ranking member, I think, during that period. And as part of your role, you were supposed to play oversight duties, on this sector and all of that. I just want to find out, did it come up at any point in time, and what was your position at the time? Thank you.
All right. So let me invite the minister to answer these 5 questions initially, and then we'll come back and take some more. Thank you very much.
Thank you very much for the questions. Let me state that since we began this journey, all stakeholders have been on board. So from the CEOs of teaching hospitals, medical superintendent, EOCO, AG, Minister for Communication, everybody has been on board. And so the issues of legality and the security issues have been referred to the AG for advice and appropriate action. So the AG's advice is maybe what will end us, or what will make us retrieve whatever we need to retrieve from the vendor. Then the issue of data. Yeah, that was another sensitive issue in thinking through the solution. But at the end of the day, we found a solution. And the solution was that because all the claims was made to National Health Insurance, we went to the National Health Insurance data and reconstructed all the data. So as I speak to you now, we have constructed not less than 14 to 15 million, and we have not less than 71 to 72 million visits. And so the issue of the reconstruction of data is secured, and we are doing more. Are you going to consider Lhims in your next procurement? That's a very difficult question to answer. But of course, I honestly think that they have not demonstrated good faith, and it will be inimical to the state to do business with such a vendor going forward. Look, in all fairness, even if you have issues with government, no matter what, and I believe and honestly believe there's no issue, you don't go switching on and off of the system, shutting it up down completely. That is very dangerous for the country. And so dealing with such a vendor is very difficult. I must be very honest with you. Very, very honest with you. The issue about reversing my position, I think that this response should tell you whether or not I reverse my decision. But you were a ranking member on the health committee. You know, this contract never came to Parliament. It never came to Parliament. So the contract was signed between the minister and the vendor. It was never a contract that was considered by Parliament. And so I think I have responded to the few questions that you asked. If there are, so you can
come on. The first contract, which is the controversy now, cost the taxpayer 100 or so million US dollars, to which about $76 million has been expended. The current arrangement, which is the Ghana Health Information Management System, which we're building entirely, how much is it going to cost the taxpayer? How much has already been expended?
Okay. So, okay.
My name is Kwabena Mintah. I'm Kwabena Mintah. I report for FM News Online. Minister, are you considering compensating the patient at the time that the system is down? When you have national health insurance card, you go to the hospital and the system is down, you have to do cash and carry. And those affected patients, will not be any compensation for them. Secondly, when are you going to see action from the AG department? You made the point that you refer the matter to AG department. How soon are you going to see AG acting on that?
Minister, that has been answered. He said it will fall under AG.
So can I go ahead? Okay, so new contract, how much? When we went through, and let me make the point that we are not starting everything afresh. It is only the software we are dealing with. The software and how we can own the software, the integration, and the middleware. That's what we're doing. So we are building on the infrastructure. The infrastructure has already been established. And so we are not going to go back to buy new laptops and what have you. So where we are, when you look at the details of the contract, how much it costs the state to do what we are going to do, we are going to use half. We are going to use half of what they use to do what we are going to do. So I can assure you that is value for money. Was there another question? Yes. Action from AG. I think I will not be the right person to answer when the AG will take action. But I can assure you that the AG will expedite action on this matter because it's an emergency. Yeah. And let me also use this opportunity to apologize profusely to Ghanaians who have gone through difficulties, inconveniences as a result of the happenings in the health sector. I can assure you that this will guide us, and going forward, we don't intend going back to this situation. And this is how a country is governed and built. You learn from your experiences and you build on your mistakes. Thank you.
Good morning. My name is Emmanuel Romeo Tete. I report for Hotel FM. Honorable, please, I want to know, as you said earlier, the first one didn't pass through Parliament. Please, the current one, has it passed through Parliament? Thank you.
I am not accusing the minister for not bringing it to Parliament. It's a process and it didn't need to come to Parliament. But I brought in that because I was referred to being a ranking member and my position on it then. That is why I referred to the issue of Parliament. But it doesn't necessarily mean that it should have come to Parliament.
So for the awareness of that, you are saying that it did not require...
It did not require parliamentary approval. It did not require parliamentary approval.
My name is Vanessa Ilotumbuating from Metro TV. Honorable Minister, my question is, what concrete legal institutional mechanism is the ministry putting in place to ensure that future governments cannot overturn or replace this new EMR or do things as real with the system? Thank you.
I think the system has solved itself. We cannot go back. We are where we are because the country didn't own the software. That's why we are where we are at the moment. So once we own the software, I don't think we'll go back to this. So that is a mechanism we have put in place to solve the situation. We are not going to go back. The software is for the state and is for the state.
Thank you, Minister. My name is Collins Kwabena. I report for KSB Media. My question is, how will the ministry monitor the vendor performance?
Yeah.
Now that multiple players will connect through the exchange. Thank you.
Well, I must confess, it was one of the weaknesses of the ministry. As I stated in my submission, at the end of each milestone, the ministry should have insisted to take control before even moving to the next step. And so we are putting up a robust system and a team to make sure that they will monitor the system well. Thank you.
Thank you very much, Honorable Minister, for those concise answers. So that brings us to the close of today's session. I thank you all for coming and making it worthwhile. And until we come your way sometime next week, have a good day.